My fellow representatives, I stand in firm affirmation of Resolution 30 to repeal the Patient Protection and Affordable Care Act and the Healthcare and Education Reconciliation Acts of 2010. My first key point: when the Founding Fathers established this government, it was on the ideals of maintaining a limited government. How long are we going to keep letting the government blunder our pocketbooks till we say it's enough? We have had enough. Also, it limits patients' choices and control. According to a UK citizen on infodirector.com, the patients get as little care as possible for visits. They also state that the average cholesterol level is 300 in UK citizens, and it is not determined until after they have a heart attack. And the government doesn't pay for routine testing, so you don't find out the needs for diet corrections until after you are dead. The individual also states that there are no standards for within what period of time you can receive care, therefore you die while waiting for care. Also, the government does everything with far less efficiency than the private sector. We will all transition from paying for private insurance to paying taxes to cover so-called free health care. Even if we switch to universal health care, it is ultimately not going to be free. There are also long waits for treatments. In the US, if you are diagnosed with cancer, you don't have to wait very long for chemotherapy or radiation. If we had universal health care, you would be on a long waiting list, and by the time you received the treatment, the cancer would have spread to the point where you couldn't treat it anymore, therefore you could die. And also, it would impose more taxes on personal freedoms we have, such as smoking. Yeah, not all of us do it, but those of the people that do, those taxes would be increased. With universal health care implemented, think about how many private sector jobs would be lost. With the current state of the economy, could we really afford that right now? Therefore, my fellow representatives, Mr. Speaker, for the reasons that we are to maintain a limited government, universal health care would limit patients' choices and control, there are government-mandated procedures and restrictions, long waits for treatments, far less efficiency within the public sector, and private sector jobs would be lost. I urge you to vote in strong affirmation of Resolution 30 to repeal the Patient Protection and Affordable Care Act and the Healthcare and Education Reconciliation Acts of 2010. Thank you.